My name is Dr. Margaret Baum. For over 20 years, I've been a practicing obstetrician and gynecologist in the United States as well as abroad. Being with people in a critical medical moment and supporting them in what they know to be the best decision for them means everything to me. Currently, I proudly serve as the Chief Medical Officer at Planned Parenthood Great Rivers, which provides quality, compassionate sexual and reproductive health care to the St. Louis region, Missouri Ozarks, and 7 counties in southern Illinois. I was raised in St. Louis, and I love living in Missouri, but it is challenging to fulfill your job as a physician when you cannot practice medicine as you were trained to do or teach medical students about abortion in the community and state where you live. I provide care in both Illinois and Missouri, and the contrast is stark. I see patients traveling to Illinois from all over the country, including the South. Patients frequently feel like they have no good options for them and that their bodily autonomy has been stripped away. Many have been forced to drive, sometimes hundreds of miles, to get the care that they need. Additionally, abortion bans make it harder to recruit and retain medical providers. It is infuriating and irresponsible that because of abortion bans, OBs can teach our students all aspects of medical care except abortion. Anti-abortion politicians and groups have claimed that abortion rights have been left up to the states. I am telling you that is not true. Last fall, Missouri voters approved a constitutional amendment ensuring the right to an abortion, but despite the will of the voters, politicians and state officials are still interfering with patients' rights. At every turn, when we finally make progress towards abortion access in Missouri, they move the goalposts on us. The only way to describe our experience over the last several months is whiplash. In order to comply with the law, our healthcare centers were forced to cancel patient appointments and cease all abortion services immediately. Not only did this cut patients off from their constitutional right to an abortion, but it sows extreme confusion when people are seeking time-sensitive care. We hear from patients over and over again that they do not know if they are allowed to get the services that they need in Missouri, including miscarriage management. It means that we are forced to send St. Louis-based Planned Parenthood patients to Illinois rather than provide the care that they need close to home. Additionally, Planned Parenthood health centers in Missouri have been fighting defund attempts from Medicaid by the state of Missouri for years. Defunding efforts harm patients with low incomes who rely on publicly funded health care and already face extreme disparities in access. Even though Medicaid funds are not used to cover abortion services, the state blocks these patients from using Medicaid for preventative services, such as contraception, STI testing, and cancer screenings, at any health center the state considers associated with an abortion provider. This has always been a direct attack on Planned Parenthood and the patients who rely on Planned Parenthood for their health care. Despite this, we have continued to welcome Medicaid patients without reimbursement because we are committed to ensuring access to health care no matter what. This is not a sustainable solution for any healthcare provider. I have seen firsthand that these draconian laws force patients to make impossible choices when Medicaid cannot cover their care. People delay care because they're afraid that they are not going to have the coverage for the services we know that they need. Patients are forced to decide if they can pay out of pocket for lab tests. They are forced to decide between the procedures that they need. They are forced to sometimes forego services altogether. It is critical for lawmakers to understand that the decisions they are making affect patients every single day. And now, once again, they want to bring this chaos and confusion to the national level. I'm here to tell you that the Senate bill proposing to defund Planned Parenthood would be devastating. It could force nearly 200 Planned Parenthood health centers to close and is a Trojan horse for a nationwide abortion ban. Let's be clear, most of these closures, 90%, would happen in states where abortion is legal and protected. The number of Planned Parenthood health centers in states with abortion access could be cut in half. In fact, these closures could eliminate 1 in 4 abortion providers nationwide. This would leave 1.1 million patients who rely on these health centers for critical and life-saving services, such as cancer screenings, STI testing and treatment, birth control, with nowhere else to go. 64% of Planned Parenthood health centers are located in rural, medically underserved, or health professional shortage areas, and no other provider can step in and replace them. This is an intentional dismantling of our healthcare system that disproportionately harms patients with fewer resources. At the same time, access to care at Planned Parenthood is also under attack from the Trump administration and in the courts. Title X is the nation's only federal program dedicated to providing affordable sexual and reproductive health services to people with low incomes. But now providers in 23 states, including many Planned Parenthood health centers, cannot access these funds. And before the Supreme Court is a case that could allow South Carolina to block people who use Medicaid from Planned Parenthood. No other aspect of health care faces these kinds of attacks. As bans have eliminated all or some abortions in 20 states, states with access are already struggling to meet the needs of out-of-state patients seeking abortion care. There is no question that defunding Planned Parenthood would delay access to timely care and make it harder for patients to get the care they need, when they need it, even if they live in a state where abortion is legal. Thank you so much for holding this forum and for fighting back to protect access to essential health care. I look forward to questions.
Thank you.